Hello and welcome to part 4, the fourth of 4 parts for anatomy and kinesiology, or functional anatomy and kinesiology for Training Made Fun. And once again, my name is Mark Baines. Make sure you reviewed the first 3 videos for this to make more sense, having gone over some of this information previously and kind of building upon it as we go. That said, in our final section here, we're going to start with muscular system overview, understanding the basic 3 muscular actions when it comes to moving or slowing something down or speeding something up or moving it or returning back to normal, holding in place. There are 3 basic actions. You have your eccentric, which is essentially lowering a load. If you're doing a push-up, as you lower into the push-up, that's the eccentric action at the shoulder and the elbow when you're lowering down toward the ground. If you're doing an overhead press, that's the downward phase as you let the load come downward toward the ground. That's the eccentric phase of muscular action. If you're not trying to slow it down, if you lifted the weight up and just let it fall back down, there would be no eccentric action. Now, it would be, if you're actually going to hold on to the weight and not drop it altogether, you're going to have some eccentric. But to really eccentrically control it, you have to be slowing it down quite a bit if you're doing that to really fully decelerate it, right? Or reducing the force, as we might say. Isometrically, you're stabilizing something when you're holding in place. If you're doing a squat and you squat down in hold position, so you're holding while the muscle is active, holding that body weight up from falling down, from you falling over and falling into the ground, you're stabilizing. Generally speaking, a lot of muscles are referred to as stabilizing muscles when their job is just to keep you still or help try to keep a particular joint area in place rather than there being a motion occurring at that joint. A lot of muscles act as stabilizers or work in a stabilizing function in a given moment in time in an exercise. It happens quite a bit. And technically, there's an isometric action right before you switch from eccentric to concentric or concentric to eccentric. It's extremely short, but it doesn't just go a constant flow of up and down. There's an up, and as you start going, before you go back down and change direction, technically there's extremely brief, but perhaps thousandths of a second, isometric action that always occurs. It's worth noting anyway. Concentric or acceleration, moving a load. For you to do a squat on the upward phase, you push yourself up. That's the concentric action for the hip extensors, the glutes, as well as the hamstrings, as well as the quadriceps for the knee extensors, and for the calf muscles, the gastrocnemius and the soleus. They're all working to plantar flex your ankle, extend your knee, extend your hip, and accelerating you upward, bring you back up once you've let yourself go downward toward the eccentric action of the squat. That said, a lot of times people will say that you're stronger eccentrically, that you can handle more load eccentrically. Yes, you can handle more load eccentrically. You can actually handle much more load trying to slow it down eccentrically than you could ever move or accelerate. That said, don't confuse that with being stronger. It's often said that way, and it's just not true. Biomechanically, it's different than that. From a very basic example would be if someone's running at you and your job was to slow them down. That's the easiest part. Requires the least amount of effort for you to slow something down. You slow someone down, just get in the way a little bit. The deceleration aspect is not that hard to do. Slow you completely? Oh, you mean isometrically stabilize. Hold still. Don't just slow down, but stop it. It takes more effort to isometrically activate, or for isometric activation of a muscle, to fully stabilize something than it does to slow it down. Okay, so more effort's required for the muscle. It's not that you're stronger or weaker. And then lastly, to actually have something coming at you and change its direction, or to have it completely still and make it move, the concentric or the acceleration aspect of muscular activation is always going to require the most force output from the muscle. That's why you fatigue first. If you're doing an arm curl, an elbow flexion exercise, you bring that load up, you're going to fatigue at a certain point, depending on the load, and depending on your strength capabilities and whatnot. You're going to fatigue at a certain point, and you won't be able to move the load anymore. But you could probably hold it still. Probably can still hold it still and isometrically stabilize at some point in the motion, and then at some point you can't hold it still anymore. Only thing that there's left to be able to do that you can actually still handle is to eccentrically activate the muscle or decelerate the load as it's coming down. Then, of course, there comes a point you can't even do that. What we don't want to do is spend a lot of time focusing on only the eccentric, like some people do what we call negative training, which is a very advanced technique for someone who's been training for several months, maybe years, and has very strong connective tissue, very strong, capable connective tissue, elastic when needed, and strong enough to handle significant loads. Not let alone good movement skill, right, and significant hypertrophy already. The only reason you actually want to do it is for hypertrophy focus. But generally speaking, every movement is going to have some concentric, some isometric, and some eccentric. It just depends on numerous factors how much there might be. That said, you see numbers like 202, 321, 422. When you see that regarding movement, it's referring to the general concept of tempo or speed of motion, and it's referring to it in terms of seconds. Now, there's no exact number of seconds that is more precisely valuable than another, but generally speaking, we often refer to something being basically 4 seconds, 3 or 4 seconds. We want it to be slow. If you think about it, pushing weight over your head for 3 or 4 seconds, that 1001, 1002, 1003, 1004, that's a very, very slow motion. So rather than counting seconds, which will drive you nuts, and drive your clients and everybody else around you nuts, trying to count seconds, just recognize that 3 or 4 is referring to slow. The general goal at that point in time for the eccentric, actually, in this case, would actually be the lowering the load, technically. Eccentric is always listed first. Would be 3 or 4 and be slow. And it's always in order of eccentric, isometric, concentric, in that it always takes less effort, eccentrically, takes a little more effort, isometrically, to stabilize a load, and it takes the most effort, concentrically, to move a load, or produce force, not produce enough force to move a load. That's why it's always in order of EIC. Don't confuse that with the motion. Doesn't mean you start with the eccentric. It's almost impossible with many exercises to start with the eccentric. You can't start with the eccentric aspect of a pull down. I mean, the load would have to start as far down as you could hold it, and then you'd start with letting it go up. It's always going to start with the concentric in most cases, right? That said, 2 is really referring to moderate speed, an average speed. If you see 2 seconds, it's referring to just a normal controlled motion. You see 0, you're not going to see a 0 probably for anything other than isometric in most cases. But a 0 simply means it's not required. Doesn't mean you don't do it or should never do it. A 0 means suggestion is you don't have to have, in this case, since isometric is the second number here, you don't have to do any isometric activation for a specific time frame. Just move from one phase into the other. Concentric, decentric, slow and controlled, back and forth, or a moderate speed in a 202 type format. And of course, a 1 refers to fast. So if you ever see 3 or 4 seconds, it means go slow. If you ever see 2 seconds, just a moderate normal speed. 1 second, move as fast as you can under control. You're not going to see 0.63 seconds or 0.298 seconds. It's going to say 1. 1 means the expectation is fast. That's all. So a 202 with an overhead press would be, the first number is eccentric, so we're actually going to look at the last number first. This one here would be 2 seconds up, 1001, 1002. Doesn't mean you have to count. It means moderate speed. You wouldn't do anything for the hold, and you just controlled come down slowly, 2 seconds for the concentric. The first part here. This 321 would be, first one's 1. If it was actually talking about overhead press, that'd be an odd configuration for an overhead press. But it's generally meaning the concentric is expected to be fairly quick. Okay, so you'd actually be fairly quick with that press. You'd be a 2 second hold isometrically at a point where typically whereby that load would be more difficult, probably more so at the beginning point, at the end range, as opposed to the very beginning. Whereas the very beginning, there's not a lot of work happening when you're already holding the weight above your head. But that's all dependent on numerous factors where you would hold it isometrically, if at all. And of course, the 3 number here would be a very slow eccentric action, very slow return downward for the downward phase overhead press. Okay, that's what you're looking at for those general ideas for eccentric, isometric, and concentric. That's a good starting point. Now, as far as neuromuscular adaptations to exercise, make sure you note that the first 4 to 8 to 10 weeks, somewhere in there, but at least 6 weeks minimum, maybe 8, 10, even 12 weeks for some people in some situations. The majority of the strength you see, the ability to produce greater amounts of force, which is what strength is, the ability to produce force, or exert force, if you will. Maximally strong person would have a higher capability of producing more significant force. Okay, and that said, it's also very skill specific, whereby someone might be very strong as far as a squat or a deadlift, which is leg strength, but yet maybe kicking a football like a punter or a kicker, they might not be able to kick the ball very far because it's very skill specific, not just strength specific. Another great example is someone who might throw a kick in a martial art, or a punch for that matter. Someone might be able to bench press a lot or squat a lot, but they may not be able to throw a powerful kick or a punch because they've not trained skill specific wise for that particular action. Skill is more significant, or skill strength if you want to put it that way, which is fair, is more significant than maximal strength. You want to first train skill every time. Be clear about what the primary goal of movement is before you worry about how much weight you can lift, how strong you can get in that motion. Movement skill, as some people often say, is king, or queen if you want, but it's the most important part. But then for those first 6 weeks, 8 weeks, 10 weeks of training, 12 weeks of training, most of it's going to come from neuromuscular adaptation to exercise, not actual hypertrophy of muscle that's giving you strength gain. It's basically getting to the point where your nervous system is more cognizant of what exactly you're asking it to do. Your coordination is increasing, movement skills increasing, such that maybe you haven't lifted in a while, maybe you've never lifted before, and all of a sudden you can lift crazier weights than you could 3, 4, 6, 8 weeks ago, mostly because the nervous system is now getting better communication with the muscular system and telling the joint what to do and telling it how to move and how to respond to stress, not hypertrophy so much. Okay, 8, 10, 12 weeks in, now we're starting to see more toward the hypertrophy, and the more the gains that go after that will probably come a lot more due to hypertrophy as time goes on. Strength endurance. While strength is the ability to produce force, strength endurance is the ability to produce force over sustained efforts over greater, longer periods of time. Generally speaking, since we want to have time for the connective tissue at the joint, the ligaments, tendons, fascia, to the supportive tissue to support the muscle, we want to give it time to respond to stress. You want to be spending more time earlier phase of training when you haven't lifted in a while, to be spending more time spent longer duration work periods, a minute and beyond probably, generally speaking, before you start going into that 20, 30 seconds or less of heavier loads for maximal strength. Strength endurance is a better strength point or a focus point earlier phase of training. And if strength is the ability to produce force, strength endurance is the ability to produce force over sustained efforts to keep going with that. Power is the ability to produce force quickly. Okay? So someone might be strong, but if they can't produce significant force quickly, they might not be powerful. Don't confuse the fact that someone is strong necessarily being powerful. Power is the ability to produce more and more work in less time, produce more force, move something over greater distances, and doing it, more importantly, in less time. That's true power. Anytime you create increases in strength, you're going to see some improvement in power. Anytime you improve strength endurance, you're going to see some improvement in maximal strength also. But when the goal is primarily focused upon being explosive, to be able to produce significant amount of strength very, very quickly, you've got to work on doing it in less time, which really means lowering the load. Whatever weight you're lifting, whatever load you're moving around, in many cases like jump training, there's really no reason to spend time with external load on someone when jumping, unless they're already having a vertical jump at 36, 40, 45 inches, when they can already do some outrageous things in jumping and explosive training. We can talk about the possibility of adding some load to them when it comes to the legs. And as far as like upper body training for power, we often refer more to medicine ball training with throwing of something, rather than trying to throw weights around. Throwing weights around, that's pretty advanced stuff. Doesn't mean it should never happen, but you got to really be cautious about that. Be really clear about, is there a safer or more efficient or more effective way to do this? Those are 3 questions you must always ask with every exercise you ever design for someone. When you say design an exercise, well, I don't know why we're doing something. You have to reason for it. Not just, this is a good exercise, we can do better than that. It has to be the safest we can think of, meaning at least minimal risk, can't have no risk. The most effective thing we can think of, which means basically no wasted time, and or efficient means no wasted time. Effective means getting results. So if you can get something that doesn't waste a lot of time, gets very good results, and is safe for the person, and it's the best you can think of in all 3 categories, you probably have about a good exercise you're going to get right now for your client or for you. Soreness, good or bad? Well, to be really clear, soreness is not good. Soreness is not a good thing. I'm sore, that's good. No, it's not. When you're sore, your body's having a hard time responding to the stress that you gave it. Now, it doesn't necessarily mean there's something wrong with your program. It could be you didn't get enough water. It could be you didn't get enough rest. Maybe your rest periods between sets are too short. Maybe your work periods are too long. Maybe the weight's too heavy. Maybe you're moving too fast. Maybe your coordination's poor. There are so many things, so many reasons why this could be the case. But it's not a good thing. It's not necessarily bad either, but it's not a good thing. The less sore, the less stiff we are, the better response we're getting from stress. And ideally, we're sore for no more than 48 hours, if at all. Okay, that's the primary goal. Overtraining takes months or years to overcome. Overreaching is basically take a few days off, come back to training, you're overreaching. Take a few days off, come back, you're not getting better, your performance is still low, you're probably overtraining. You need to take a couple back steps in what you do. More rest, more sleep, lower intensity of training. Finally, atrophy is muscle fiber loss. Hypertrophy is muscle fiber growth. Hyperplasia is growing new fibers. Hyperplasia is not going to happen unless you're a freak of nature like a super athlete. Hypertrophy, growing new fibers, we can all have happen. And if we don't use those fibers, in as little as 2 or 3 weeks, we can lose them toward atrophy. That is kinesiology and functional anatomy. And this has been Training Made Fun, and my name is Mark Baines. Look forward to talking to you again soon for a new unit. Thank you.